Yeah. Here we go. I've got this turned off. Oh, I'm saying, give me 1 second and we're going to get going. Da-da-da. All right, I've already been asking. We've actually been on here for a little while because, well, the Zoom and the webinar started earlier than we expected. So let me do this. There we go. Make sure our recording is going. I'm just checking with my team to make sure everything is recorded because this came off and started a little bit earlier. So I want to make sure that we are running and good
I don't know
because,
why it didn't, usually it closes it and puts them in a waiting room
yeah,
for practice session. I'm
yeah,
not sure
it's
what
okay.
happened on the setup, but
I
it
think,
does look like on our end that the panelist feature is working fine and the recording started when you hit that. So
okay,
I think,
perfect. So we should be good to go.
yes.
Okay.
Great job keeping us all entertained. 10
I'm
minutes
just talking.
earlier than you
Anybody that,
expected. We've never had it
anybody that
happen. We've
knows me,
had multiple
talking
webinars
is
with over 1,000 attendees and
yeah,
doesn't, and never has it
right.
happened.
Well, and I love this. The reason why we have partnered with Strive, so MedBio Institute, that is who we are. We have partnered with Strive Pharmacy to bring you, again, multiple verticals and different avenues of resources to help your practice, not just in a sense, survive through this GLP-1 shift that's actually happening in the industry today, but to thrive and to grow through it, and to be prepared. And so, as I was talking before we started, I mean, we have people that are going to continue to come on. I think we're at 250 people right now on here. We've had over 1,200 registrants for this specific topic because NAD and methylene blue are two incredible modalities that can be implemented and can truly be life-changing for your clients, for your patients, which is a whole lot of fun. We are going to talk later about our GLP-1 summit that is coming up. So if you were already listening to me rant earlier, we are going to talk about that. That's April 18th and 19th in Phoenix. Our main sponsor is Strive, and it's really going into this industry and, again, being prepared for what's to come. And in a sense, there's always going to be some sort of worry and shift in any industry that you're in. There's going to be shifts, there's going to be changes, but the more prepared you can be for those shifts and changes, well, the more successful you're ultimately going to be. So we want to make sure that we're going through that with everybody. Oh, there's somebody that knows me because I see the DAB. I've been known as DAB through David Adam Boonder, Dr. Adam Boonder, either way. I know, I'm like, oh, they know me. But again, today we're going to be talking about NAD, methylene blue. I wore my blue because it's methylene blue. Rhonda just shakes her head. Okay, my wife shakes her head. Christy put on the blue as well. And look, Lindsay inadvertently has a background. Oh man, the background of the blue went away. But
I
we,
really was expecting a blue wig from you today. I mean,
I
that's
know. So,
some kind of fun, blue axe, maybe. I don't know.
yeah. Yeah, I did carry an axe at the last event that I was at because we got to stop biohacking people. We got to start bio-optimizing, which is exactly what NAD and methylene blue do. See how I just shift it right back to the purpose and the topic of what we're doing here? We have two incredible educators with us today from Strive that are going to be speaking again specifically on NAD. We also have Rhonda and Lindsay who are here with us. They are a couple of our keynote speakers that are going to be at our GLP-1 summit. Again, that's April 18th and 19th. So if you aren't signed up for that, you aren't going to want to miss it. We have live in person and we have virtual tickets. I'll talk about that later. But not only are they going to be speaking today on NAD and methylene blue, they'll actually be at that summit as well, speaking on some really, really cool topics. I mean, LDN, GLP-1s, we've got supplementation GLP-1s, we have how to build your practice, the blueprints. It's all going to be in there, but I don't want to continue to talk. I want to make sure that we have time because everybody is here to listen and learn about NAD, methylene blue, how this works with our patient bases, and really what it does for their health and for their wellness. Everything from mitochondrial function, redox reactions, oxidative stress, all these really, really fun things that we can really dive super deep into. But I've already looked at y'all's PowerPoint. It's amazing. It's direct, it's to the point, it's the information that people need to be able to move forward. So what I'd love for you guys to do is if you could show your screen here, and we're going to get going into this fun topic. And every once in a while, just for fun, I'll throw in some questions as you guys are talking, and we'll make this fun for our attendees. And I do want to say thank you. We are honored and excited to have everybody on here that's joining us today. So thank you for your time. We know that it takes time, and thank you for being willing to constantly learn. And that's what this is about. So let's get going.
Awesome. Thank you so much. So I'm Andrea. I think hopefully I've had the opportunity to meet a lot of you previously, and this is Valerie. So another pharmacist from Strive. We're both part of Strive's clinical team. So always excited to share information, always learning, always growing. So we are here to share about NAD and methylene blue today. Give me 1 second while I probably mess this up. Are we good?
You did great.
Are we on?
I think everyone can see the
You are
slides.
good to go.
Okay,
Yeah.
good. So, like Andrea said, my name's Valerie. I'm a pharmacist with Strive. We are going to talk about NAD and methylene blue. In case Adam didn't say that enough, we are going to talk about that today. We're going to talk about how it works with weight loss and how it can be effective in your clinics. So, go ahead and
Go next slide.
Yeah.
And this is an interesting subject because with a number of the other products that we have talked about, there has been a lot of focus on how they perfectly complement the GLP-1 therapy and whatnot. NAD and methylene blue will complement the GLP-1s as well and help support weight loss, but really have a huge focus on anti-aging and longevity as well. So kind of in addition to, your GLP-1s, does have some synergistic benefits and whatnot, but a great addition for health and wellness.
Yeah, I think we have a slide at the end, kind of how it goes with GLP-1s a little bit better. And also we know there's a big elephant in the room about GLP-1s, and we'll try and touch on that at the end. I know I've monitored the chat for these webinars, and I know that those questions come up, and I can't see the questions currently. So one of our other pharmacists is also looking at those and hopefully answering some questions for you. But we will try and touch on that at the end when we have some time. So we're going to go over some cellular health and metabolism. We're going to dive deep into NAD plus and methylene blue. We're going to tag team it, but I'll be mostly NAD plus, and Andrea will look at methylene blue and the importance of these compounds for longevity and weight management. And we know longevity is a huge, huge topic in functional medicine, and everyone wants to live longer, right? So we will talk about how these medications help those.
Yeah, and absolutely not even just living longer, but living well longer.
Yeah.
The importance of that. So.
All right, so what is NAD plus? It is a coenzyme for redox reactions. It helps with energy metabolism. It helps with sirtuin activation. So I'm learning about sirtuins as well. So I'm just going to do a little, if you already know about it, sorry, I'm educating you a little bit more on it, but they are a type of protein involved in regulating cellular processes. So they help with the aging and the death of cells and their resistance to stress. So it is very important to have this NAD plus to help with those sirtuins. Mainly, I believe number 1 and number 3, the SIRT1 and SIRT3. We'll go over those a little bit later. It also helps with DNA repair. So it is utilized by the PARP enzyme, which plays a vital role in helping DNA damage repair. It helps in cellular signaling. And it helps in aging and disease. NAD plus decreases over time. And if you look at the research out there, there's not a good number. All the research that comes out says by the time you become your adult age, it's anywhere between 10 and 50% decrease in NAD plus in your cells. So it is important to try and replace it. And it's an ongoing research investigations on what is the best way to increase our NAD plus in our cells. So there's a huge connection between the aging and the metabolic health there. This is the NAD plus cycle. I threw this in at the last minute because it just is easier a little, and it was beautifully already green and matched our presentation. So it kind of shows you how NAD plus is made and how it breaks down. So the processes in the cycle, I'm not going to get into it too much. These slides will be sent out though, so you'll be able to see and look at this graph a little bit later. There, like I stated, there's a natural depletion over time with NAD plus just from aging regularly, but also your lifestyle and environmental factors can accelerate decline. So if you have increased inflammation, and that should be a key right there, GLP-1s help with inflammation. That is a problem, and then DNA damage, and we can get that from environmental stress, oxidative stress, all that stuff that you're taking in from the environment, the way you eat, the lifestyle you lead. So that can decrease your NAD plus. If you live a healthier life, which we'll get into, lifestyle modifications later, that will help, but your NAD plus is still going to decrease. If you're the healthiest person, your NAD plus is still going to decrease. So we want to have the supplementation there. So what are the consequences of the NAD plus decline? Reduced energy, cognitive decline. This is a huge thing, right? We're worried about ourselves and our parents and everyone in our family. No one wants to be in the dementia realm. And so making sure that we do everything we can on our end to help not have the cognitive decline. And then also, we've already stated, but metabolic dysfunction. So metabolic dysfunction really increases our inflammation, increases our all the processes that make you kind of unhealthy. And you're all in this functional health realm and longevity, so you've heard about these from other places as well. NAD plus and weight loss. So we've talked about fat metabolism, mitochondrial function, but NAD plays a crucial role in these. One, helping insulin sensitivity, improves insulin sensitivity. Like we talked about those SIRT1 and SIRT3. So SIRT1 specifically helps with aging, metabolism, and inflammation, and then SIRT3 helping with mitochondrial function and metabolic regulation. So NAD plus is essential for the function of those sirtuins. And then it also helps boost mitochondrial function. So it's a key production, key for energy production in the mitochondrial, improves how the body converts food into energy. And then it also reduces inflammation and oxidative stress. Adam talked about oxidative stress earlier, but that leads to chronic inflammation. It leads to the insulin resistance. And then NAD plus also supports fat metabolism and energy expenditure. So NAD plus promotes the breakdown of fatty acids for energy as well. So that's how it helps. There's 4 steps right there just on weight management, which will obviously help with your GLP-1s as well. We can go to the next slide. Thanks. And then I think this is my last slide. It's boosting NAD plus levels. This is where working with your compounding pharmacy kind of comes into place. So we have, or most compounding pharmacies have at least three products. So NAD plus comes in an injectable, which can be used in IV, and then they have a troche and they have a nasal spray. Now, it really depends on the person. So I think I haven't done an NAD plus IV, but I think Andrea has.
I've never done an
Oh.
IV, but yeah, they
I have.
do you want to tell us your experience with it?
Yeah. No, I've done up to 1,000 milligrams NAD infusion. I always say it feels funky. That's the best way that I can describe it. You can get kind of a flushing, almost a weakness. It's interesting. Like when I was doing it at the time, it's almost like my hand-eye coordination wasn't quite the same. It's like it really is like a rush of metabolic activity happening within the system. And there's been a couple times when I did it, like afterwards, I was a little bit drained, but like within an hour or so afterwards, it was just like rocket fuel. In my practice, when we would do this, I mean, we utilized it for a lot of different things. I mean, just energy. We utilized it for addiction. We would actually do high doses over time to help people break addictions, and it worked very, very well. In fact, we had one patient was a smoker. They came in, they did 2 weeks of high dose and they literally came back to like, I'm not even craving a cigarette anymore because of its effect. I mean, obviously not just on mitochondria, but serotonin, dopamine, how it's resetting that system. So, yeah, no, I will tell you, because I've done IV, I've done IM, I've done sub-Q. You can get the same feeling from all of them, but I always say, start low and kind of grow into that higher dose. But when you get to those higher doses too, you want to make sure that it's a very slow drip rate. You don't want to go too fast. Because yeah, your heart can start racing, your chest can feel tight. Those are just, again, you're not going to get hurt from it, but those are just the feelings and the sensations that most people have.
Yeah,
I
and
get very stuffy with it too, like my nose gets very congested and limbs feel heavy, chest can feel tight. Yeah, for sure.
Are there any particular actions you take when that's happening for a patient, when the patient gets nervous, that, like chest pressure or things like that, that kind of help to alleviate that? Or do you just push through it?
Actually, I mean, if you're doing a drip, you just slow down the drip rate and it goes away. Like if your drip rate's slow enough, you actually won't feel that. If it's too fast, that's usually when it flushes the system.
Okay.
Yeah.
Yeah.
absolutely. So a lot of times I know we tell providers it's a great supplement, especially done, IV or whatnot. People will feel great benefit very quickly, but you have to be present with your patient, almost sometimes babysitting that patient, especially through the first drip or whatnot, because there are some unexpected side effects and whatnot. And that's just what they are. They're side effects, things that will go away, just like Adam mentioned. I know I utilize it subcutaneously. So I choose to do it subcutaneously 3 times a week. Every once in a while, I will feel a tightening of a muscle group here or there. Some people do state it will do the tightening of the chest. Again, a side effect. So not an adverse reaction, not something negative, just the side effect of the medication. So something to keep in mind.
Yeah.
Yeah, and we have the troches and the nasal spray as well if you're not interested in going through the IV right away. And I'm always a proponent of start low, go slow.
Yes,
So
absolutely.
very glad you said that. But yes, we have the nasal spray, we have the troches, we have the stuff I've received back from patients is saying, I don't necessarily feel the same thing if I did the IV or the injection. I don't feel it right away. But if I stop taking the nasal spray or the troche, then I notice that my energy is less. So it's kind of a slow growth, and you might not notice it until you take it away. But it is helping with your energy levels and the NAD as well, just not like you would notice in the IV where you get it super fast. We also need to talk about supplementation through the precursors, right? So we have NMN. There's also an NR precursor, and I know that this has been talked about quite a bit just in other aspects of things if you go to A4M or whatnot. We offer an NMN supplement. It is a precursor to NAD+, and we are currently working, I know a lot of you were on the supplement presentation with Joey. We're currently working on an NAD+ bundle, or even just one medication that will have a bunch in there that has the NAD+ precursors. So it'll have NR, and then potentially a CD38 inhibitor, which will prevent CD38 from hydrolyzing NAD plus into nicotinamide. So it will increase the intracellular NAD plus levels. So we're researching that right now and hoping to have that in a supplement for everyone once the supplement line gets launched into bigger things. Right now we have the GLP-1 bundle available on our Strive shop, but looking into these other options, especially in boosting those NAD plus levels. So super excited about that. And we've already talked about the troche, the nasal spray. I always like to say the injection is best, but if you don't want to if you're scared of needles, the bioavailability of the troche and the nasal spray are going to be less, but it's still an option and it still works. So I'm not sure if that question's out there, but yes, injection is probably best. And then of course, if you're our California clinics, we're working on getting NAD plus into California, but it's not there yet. I know we usually have a couple California people on here asking questions about that. And then also, we'll talk about this maybe a little bit later with methylene blue, but reading in some of the studies that I went through about topical NAD
Yeah,
plus.
I was just gonna
And we
mention that.
have
Yep.
topical NAD plus on our dermatology line.
Mhm.
So not sure
Yeah.
if you want to talk a little bit about that. I
Yeah,
can't
it's-
remember the name. Restorative.
it has some fancy name, but it is a topical NAD plus, intended for, for dermatological purposes, but is really showing some great anti-aging benefits, topically. So, NAD plus can be used from the inside out, which is really incredible. So,
There's one article I read, and we have our resources here at the end, our references. They stated even helping with some skin cancer. So hopefully more research comes out about that. But I'm super excited to try it. I already asked my doctor to send in a prescription. So after reading this article.
yes, absolutely. Yeah. All right, so that's NAD plus. Let's move on to the blue stuff. So methylene blue, everybody's dressed in blue today. You take methylene blue, what happens? You pee blue. So that's kind of a fun side effect of methylene blue. That's how you know it's working.
Well, I will say, make sure that you let your patients know. I made that mistake, and it was actually one of an NFL player that I was working with. I was like, "Man, you gotta try this stuff." And he goes home. He calls me freaking out. He's like, what happened? What is this? And it was green. So I mean, think about if you're dehydrated and you pee in blue, it turns green, yellow, blue. But I was like, man, you're okay. I go, that's just the methylene blue. It's coming through. So yeah, that's just make sure that you let them know. You don't want them to get freaked out.
Exactly. It was funny. We had a meeting on Monday. So that was St. Patrick's Day. And somebody's like, we need to combine methylene blue with the vitamin Bs and like everybody can have green tea for the day instead of blue. And so it was a huge joke
Awesome.
on Patrick's Day. So, but methylene blue, it was originally synthesized as a textile dye in 1876. So it is a synthesized medication, one of the very first synthetic drugs to ever be used within medicine. Soon after it was synthesized, it did show to have some medical applications, including the treatment of malaria. Currently, it's FDA approved and used for methaglobinemia, in where the methylene blue helps oxygen to bind to the hemoglobin. So that's when it's used kind of at those higher doses. That's when you'll see it used within, the hospital realm or whatnot. Obviously, we're not going to be utilizing it for that purpose in this case. In our situation, we're using it for anti-aging, for cognitive function, for energy and whatnot. So methylene blue is an electron. Oh, go ahead.
And Andrew, when you say higher doses, what are you talking about typically with those high doses?
So the higher doses are much considerably higher. We're looking at, I'm not even sure the exact doses for methaglobinemia, but there are some higher doses used up to, even 100 milligrams for things like Lyme's disease we were learning about. Those doses I'm not truly aware of.
In the hospital, they dose it in milligrams per
kilogram.
kilogram. And so it is definitely weight-based in there, and they are much, much higher doses. Nothing we use in this setting.
Yeah, in this setting for what we're doing for cognitive function and whatnot, it's going to be closer to 5 milligrams to 25 milligrams. And we'll hit on it a little bit later, but once you get over that 25 milligrams, some people will try to push into 50 milligrams a day. You actually start seeing paradoxical effects, so opposite effects of what you're looking for. Now, those higher doses do have a place in therapy, like I stated, sometimes used in Lyme's disease, other situations like that. But for our purposes, as we're speaking today, 25 milligrams is probably going to be one of the upper limits that you'll utilize for a patient.
And
So,
that's typically, and the reason there's the high and the low, I mean, and you kind of mentioned this, at higher doses, it's more like a pro-oxidant. At lower doses, it's more of the antioxidant effect. So you're getting more of a hormetic effect with the high doses for individuals, in a sense, kind of like ozone or something like that, if you're doing those type of modalities, right?
yeah,
Is that,
yeah,
I'm saying that correct, right?
that makes sense. Yeah.
Yeah.
You got it. You got it. Awesome. Methylene blue is an electron cycler. So it's actually called an alternative electron carrier in that it can both donate and accept electrons. So that's pretty cool. Does both. After ingestion, methylene blue will concentrate in the mitochondria, this including the brain. So it readily crosses the blood-brain barrier. So that's how we get those cognitive effects. So at low doses, which I was just speaking of, that being between about 5 and 25 milligrams, it will donate electrons to the electron transport chain, ultimately increasing ATP production, energy production. It enhances the function of the cytochrome oxidase, which is complex 4. So there's the 4 complexes, 2 and 3 sometimes don't work as well. Methylene blue is able to skip over those 2 complexes to really concentrate in that complex 4, making it work more fast, more efficiently, again, increasing ATP, increasing those energy amounts. It can also increase the amount of NAD. So there's a synergistic effect, increasing NAD. And it also functions as a powerful antioxidant. So like Adam stated, the antioxidant benefits are really, really great. It'll scavenge in the mitochondria and the cytosol for those free electrons that might be wreaking havoc on the body, and helps to accept and neutralize them. So those are some of the functions of methylene blue.
And I was going to mention, we've done a couple trainings with Dr. Thomas Levy, who is an expert in the world of like vitamin C, high dose vitamin C. And it was interesting because the benefits of methylene blue, I think, are so outstanding. And the fact, like you said, in a sense, it recycles itself when it's being utilized. So it can donate and accept. And his comment to me was, he goes, as he was learning about even methylene blue, he said, I think this is, and it's crazy. He's written, I think, 12 books on vitamin C. And he's like, this may be surpassing the effects of what vitamin C can actually do for the body on an antioxidant level, just because of that recycling system that it actually has, which is fascinating to see, because we know, a lot of us know what vitamin C can do for the body, and for oxidative stress and for healing and restoration. So I think that's a key thing to understand too, and the importance of that recycling of methylene blue.
Yeah, absolutely. Thank you. Thanks for adding that. When Valerie and I were going over this, we were talking about oxidative stress and reactive oxygen species and whatnot. And I'm like, okay, I had to like step back and relearn this. Like, it's been so long since, I graduated school, and I wanted to make sure I understood it. So I'm like, Valerie, this is how I'm going to explain it. Well, I told her I wasn't going to do this, but I'm going to do
She's
it
doing
anyway.
it.
I'm doing it.
Do it.
I'm also a mom. I have 4 kids, so I sometimes have to break things down in a way that I can help them understand things as well. I'm like, we've got these, oxygen species out there, and their electrons are off, and they're like just floating around like this. And methylene blue is going to come in and either donate electrons, take electrons away, so that they go back into normal function. So when things are wreaking havoc in your body, that's happening, and that's causing that oxidative stress. That's causing so many, unfortunate disease states, causing cognitive disrepair and whatnot. Methylene blue will go in and stabilize those and help them to work in a more neutral situation. So that's how I was explaining it yesterday.
I'm so glad you presented it, because I thought it was a good way to show it. And she said she wasn't going to do it.
Well, yeah, I did it. I did it. So
I'm glad you did.
I did it. So it does have its role in the mitochondrial support and the antioxidant activity, which is what we've been talking about. It's going to just ensure that electron transport chain is working properly. Again, supporting that complex 4 to produce as much ATP as possible. So as much energy, increasing the metabolism and whatnot. Can slow aging by preventing mitochondrial decline and reducing inflammation. Again, we spoke about inflammation earlier with NAD, how inflammation just wreaks havoc on the body. Our GLP-1s are going to help to decrease that inflammation as well. Decrease inflammation, decrease oxidative stress allows for that weight loss, additional weight loss, in conjunction with GLP-1s. So supporting cognitive function, methylene blue is highly lipophilic, but therefore it is able to cross the blood-brain barrier very easily. This is going to enhance neuroprotective effects, preserving the cellular function in the brain. This leads to improved memory, focus, mental clarity, better mood, emotional resilience as well. I know that I use methylene blue. I use it very often, but I do make sure I use it on days like today when I need a little bit more focus to make sure I get the information properly to you. It really does help with my focus, with my mental clarity. So from a personal experience, I can say that I notice a benefit from the medication itself.
I want to say that I don't use it, but my husband does. He's actually sitting in this room. He works for Strive as well, and he has to be very quiet right now. We told him. But he started using it, and I honestly noticed him remembering things better. So this
He
is
remembered your name.
he remembered my name.
Good.
No. He remembers appointments better. He remembers things that I told, like I'm promoting this to all the women out there to give it to your husbands, because he, like, even the other day I had an emergency dental appointment. I was like, "What time's my appointment again?" He's like, 12:40. And I was like, "How did you even know that?" Like, I don't think I ever told him. It might have been on the calendar. I don't know, but I just think his mental clarity is so much better from taking this medication as well.
Absolutely. So methylene blue and metabolism, kind of touched on this a little bit. So I'm actually going to talk a little bit about the safety profile right now, because I know there's always a lot of questions about the safety of different medications and whatnot. So when taken at low doses, as we were talking about earlier, it really does have a great safety profile. The biggest side effect is going to be the blue urine. Fun party trick. Uh, so there is a potential for serotonin syndromes because methylene blue can act as an MAOI. So with that being said, you do have to be aware if patients are on SSRIs, if they're on SNRIs, or any other drugs that can increase serotonin levels. I will tell you, in my time working with Strive, working with methylene blue, I've never experienced a patient who has gone into, who has experienced serotonin syndrome. But that there is a great warning with that. So please do use caution with patients that have that potential.
I would say, just to interject real quick, is too, there's a difference in, like you said, most of the dosing is going to be on the lower level of dosing. I think it's a lot of those cautionary, I guess contraindication sides of things is also if you're going to be bumping up into those higher doses. I know a lot of us, so all the women are listening for their husbands. My wife isn't listening, but she'd be nodding her head. Yes. Okay. I take methylene blue on a regular basis as well, and my kids do actually as well. But I will say too much of a good thing is not necessarily a good thing. So maintaining those lower doses regularly is beneficial, but don't try to say, oh, if I'm taking 10 milligrams or 25 a day, I'm going to go up to 50. Um, just make sure that you're staying at that lower dose because the benefits are going to come.
Yeah. So, and I was just going to jump into that. So thank you for mentioning the higher doses, because they can have, as we said, the opposite side effects. At times they can cause some hypertension. You might notice some dizziness, some GI distress. Not the cognitive benefit may not be there. So just keeping to those lower doses is really going to be most beneficial. Hasn't really been studied in pregnancy and breastfeeding, so contraindicated in that at this time. And then also in patients with the G6PD deficiency. So this is going to most often be at those higher doses, but do be aware that there is a risk of hemolysis in those patients. So and not everybody tests, for that deficiency or whatnot at lower doses. That is likely not going to be as big of a concern, but that warning does exist for methylene blue. So those are kind of the warnings. There is more emerging research on weight loss, obviously continued research on anti-aging, but we really know that the methylene blue is going to help with weight loss and helping to increase energy levels, increase that ATP production, decreasing fatigue, and also helping to break down the stored fat. So that's listed there. Combining NAD and methylene blue for optimal health. Let's go there. So how they work together. They do have a very synergistic approach to cellular energy optimization, neuroprotection, and anti-aging. I use both of them. So they can be used together at the same time. They are going to work a little differently. Obviously, we talked about the different mechanisms of them, but they do work synergistically. And in combinations with GLP-1s, they again target that mitochondrial production, increase energy production, which will also increase fat metabolism.
And I just want to say, we've talked about the lower doses, right? Starting low, going slow. Same thing on GLP-1s. I am a big proponent, and I'm sure you've seen things about patients microdosing. There's no research out there on microdosing, but I microdose myself on a GLP-1, and the benefits are still very much there. You are decreasing inflammation. Then if you add methylene blue and the NAD plus that can further support the antioxidant defenses, you're really fighting inflammation there. And I just think in general, GLP-1 therapy is going to be around for such a long time and such an amazing beneficial medication. Regardless of which one you choose, they all help. I know some people prefer one over the other just based off of side effect profiles, but it's just so beneficial in those areas. And adding on these these supplements, the methylene blue, the NAD plus, then you can really help. If you're having patients who are on GLP-1s and not losing weight or something along those lines, and adding these to maybe help with those defenses as well, can help bring that weight down or bring down that inflammation.
Absolutely. I mean, I think just the fact and the commonalities between the two, a lot of it is increasing that mitochondrial function. So if we're increasing mitochondrial function, we're increasing metabolism on a cellular level, even an intracellular level, which is going to help obviously through the, I mean, on that weight loss journey as well. Now I have, and we're probably going to get into this as well. I mean, there's the synergistic effects of everything, but methylene blue, so not on NAD, but methylene blue, it's 100% absorbable, right? Like whether it's oral, in any form that.
Compound it as a capsule most often, just
Mhm.
because troches are very, very messy.
Blue.
Very blue.
I'll just say if you're going to go on a date with your wife, don't do a methylene blue troche that same day, because then when you smile off your pictures, you got blue teeth and it's not good. And the stuff will stain everything. It is a dye that will stain everything. This was a white shirt early. No, it wasn't. It was already blue.
Washed it with the methylene blue troche. No,
Um,
when we first compounded methylene blue, so we actually can compound the troches with a number of different products together or whatnot. But when we were testing it and whatnot, a few of us pharmacists we were trying it. And one of our pharmacists, I mean, he's fantastic, but he talks all the time. And Pat's just talking and talking, and he's just drooling blue. We're like, Pat, just wait a minute. Like, stop talking for 1 second, because he just had blue everywhere by the time his troche was done. So with that being said, we most often see it as a capsule. We do have a supplement on our shop.strivepharmacy.com. That's a great methylene blue supplement. I have a picture of it coming up here, but it's something that you can purchase even as an over-the-counter product. It is at it's at the 10 milligram dose, so a bit lower. The compounded doses, we most often, as I stated, go up to 25. But a capsule is a great way to utilize this product. So absolutely.
And we've had some reports from patients starting at 25 or starting at those higher doses, they'll feel almost like an anxiety effect. And so I do, like I said, start low, go slow. I'm a big fan of the 10 milligrams, or I talked to a provider yesterday who does 5 milligrams. So knowing that those lower doses are out there, and then you could slowly move up if you wanted to, but yes, maintaining a low dose regimen.
and does it have to be prescribed?
So we actually have it as an over-the-counter supplement.
Okay.
So Strive
that's
does
what I
have,
thought.
yeah, it's part of our Strive nootropic line. There actually is a Strive nootropic that's NMN as well. So those are found on the shop.strivepharmacy.com. I don't know if one of our pharmacists in here can put that in the chat, link that. But it is available, which is fantastic. So either it can be ordered wholesale into your practices so that you can sell it to your patients, provide them with education, or patients are able to buy it offline. So
you
can and then
call it as a prescription. Either way, like we also do the over the counter is only the 10 milligrams, or I would normal okay dose. They can also call it in as a prescription up to the 25 milligrams. You can do a 5 milligram dose, you could do a 10 milligram, but you can do prescription as well.
And I've been asked a couple of times, and we never did this. I don't know why you would need to. Obviously, understanding the absorption of, I mean, when we were hosting our trainings on, high dose vitamin C, methylene blue, ozone, like people would say, well, why would you do it IV if you can still absorb it 100% with an oral? Because that is one of the few. I mean, not all oral supplements are you going to absorb 100% of that supplement like most other. I mean, we could name any other supplement. It's not quite the same, but my only answer to that truly is probably because if they're needing to go into the higher dosage range, that you'd be doing more of the IV type therapy. But I will tell you, it looks really cool when you push methylene blue up into an IV bag. But the bags too, this is one of the things that we did train on. It was D5W, not saline. Is that your recommendation too, if you're actually going to be putting it into an IV bag? Or do you have any recommendation there? And
Rhonda
Rhonda,
said
you may come
Yes.
in.
Yes,
That's
it should be mixed with D5W if you're giving it IV.
Yeah.
thank you.
Yeah.
And I totally agree with what you're saying, that I don't use much IV methylene blue anymore just because the capsules are so bioavailable that there's just no need to go that high of a dose, that much of an expense, that much time in a chair, when you can literally just take your 10, 20 milligrams a day and be good with it.
And you also had to change your countertops 3 times, right? Because it spilt everywhere. Is that? No, not really.
Heck, you can vitamin C unhinges that, so then it
Yeah.
gets rid of the blue. So gargle with vitamin C when your teeth are blue.
Yeah, it does work. I've done it. My kids have done it. I actually mix orange juice with the methylene blue. It does help because it does have a very bitter taste when you're drinking it too. If you're drinking the methylene blue, but what I want to do right now, we're going to come back. I know there's a lot of questions. In fact, one that we do not want to miss was actually about hepatic function, kidneys, things like that with methylene blue, because I believe that there may be something, and we can maybe address this now, and then I'll move on. But
I've also, Adam, just here where I typed up as they're going in the chat, I've been typing up a whole list. So
okay,
it should
perfect.
streamline things when we get to Q&A, and I'll
Okay,
keep updating.
perfect.
So.
Well, then what I want to do is just take a quick moment here with everybody and go back. We talked about this at the very beginning, but our GLP-1 summit that we actually have that's coming up, and we've had a lot of questions regarding this summit because of the state of this industry and where everything is going right now. We've had people like, is it even, valid to have a summit like this when there's all these changes within the industry, and are GLP-1s even going to be available? What's Strive's stance? What are all the things? These are all the things that are actually going to be answered at this summit. And again, the purpose of this is to allow you to be ahead of the game, not be waiting to see what's actually coming at you, because I can tell you a reactive response in business, a reactive response in life is never going to get you far. You're just going to worry. You're going to stretch yourself so much that you're not going to move anywhere. And that's, again, why we are offering these other therapies and modalities, to bring this information to you so that you can be more prepared than the clinic that's down the street that isn't doing anything and is going to be left just wondering what they can actually do. So this summit is coming up again, April 18th and 19th in Phoenix, Arizona. The Wigwam, man, I can't even say it. Wigwam Resort. Say that 10 times fast. I couldn't say it once fast. So this is setting a gold standard really for GLP-1s, but even beyond that. And we're blessed to, again, have Rhonda and Lindsay. Really, Rhonda works within that clinic. I don't know how many patients she has seen in her time there and outside of there, and what she does with GLP-1s and other modalities to build the practice. But I can also tell you that she has it's like a 82% close rate on talking to patients. That's incredible. I mean, the truth is, if you can't talk to a patient, when I say closing a patient, what I mean is you're actually selling a patient on a therapy or modality that you're doing, which if you can't sell a patient on what you're doing, your patients aren't going to take care, because that is the world we live in right now in this industry, because patients are coming in, they have so many questions. If there's a way that you can navigate those questions and help them understand what they need and to do it right, that is what you need. You truly need to be able to help to explain to them why they need the certain modalities, the therapies, the GLP-1s, and how to do it the right way. And they're just a tool. All of these things are tools in a tool pouch that you have that can help your patients get to their goals and get to the place that they ultimately want to be. So with that, again, we have the Wigwam coming up here in Phoenix, April 18th and 19th. You can actually go through and get your tickets now. I'm going to share with you something special, an opportunity that you'll have today till midnight tonight. But what are you getting? 2 full days of GLP-1. We have the science, the education. We have Patrick Porter that'll be there on Saturday with Brain Tap. We have Jeff Cohen, who's coming in as an attorney to literally, he's on the forefront of all of this. He's working specifically with clinics that have been through this and helping to make sure that these are available for people. And so he's going to bring that industry understanding to you. The thing that I love about our events is that you actually get to sit there and actually talk, rub shoulders with the speakers, the presenters, and truly talk with them one-on-one to learn. That's not somebody that's up on stage that's too far away. It's very interactive, very close. We have Lindsay, who has helped to build obviously a $1 million practice in 12 months, implementing these modalities, not just GLP-1s, but more. And so getting that blueprint, learning from the experts. If we scroll all the way down, close your eyes if you get dizzy. Sorry, I'm going to go all the way down here. We have a bunch of Q&A down here. So if you have questions about the event, you can click on the Q&A. But again, when you get your tickets, you reserve your spot. Make sure that you book your hotel room, because we want to make sure that hotel is booking up very, very fast. We're what, 3 or 4 weeks out now? 4 weeks out. So it's coming up very, very soon. Right now, we have our tickets, single tickets, double tickets. There's a price reduction as you buy double or multiple, because a lot of our practices don't just come for their providers. They're bringing their back office as well because of the business side of it. How do you market? How do you educate? How do you teach them to be able to sell these modalities and to build the practice properly? Right here, it says enter a coupon code. For those of you that are listening right now, we are offering you a 35%. This is actually the largest discount we have offered so far to date. And I think this is the last one, because this is the last of our series that we're going to be offering here. It is NAD 35. It's at a 35% reduction in the price of your ticket. That would be applied to a single ticket. It can be applied to the double ticket, the triple, and then we have live stream. So it's applied to the live stream as well. If you can't make it, make sure that you get on the live stream. It will all be recorded, so you will actually be able to have that on the back end afterwards. So this is the check-in. Again, if you want more information on the summit right here, you can ask us questions as we go through today. I know you have a lot of questions on the methylene blue and the NAD, but if you have questions about the summit directly, just ask us. We'll do our best to answer it. But we really hope to see you there. Again, this is about being prepared, about being proactive, not reactive in this industry. I know we have a lot of people that are worried. You don't have to be. We've been talking about this on the back end from Strive to our team to make sure that those that are coming, the discount is NAD 35. So just make sure that you put that in on the checkout. Make sure that you go and book the room, because the hotel is filling up fast. So you don't want to miss that as well. Yeah, so a single ticket is actually for 2 days. So it's both Friday and Saturday for the event. And from there, there is a link to register. Christy will make sure that she puts that link in here for that. I know all the questions come in, and then she fills in the rest of it and puts it in. But what I want to do from here, I'll talk about this again at the end if people have more questions, but I know that we really want to get to a lot of the questions on NAD, methylene blue, implementation in your practice, and how that can help your clients, your patients, obviously get the results that they're looking for. So, Christy, you have a list, right?
Yes, I
There
do.
we go.
Let me open that up for you guys. I was just answering one more question. The discount code expires at midnight tonight. It's 35% off. It does apply to in-person and virtual. It's
Yes.
NAD 35. So I put it in the chat. It's just further up. So I was just about to hit send on that. So I just thought I'd answer it here.
NAD 35.
Yep. Okay, so some of the questions I was kind of trying, I know since we had 2 topics, I went back through the top and have worked my way down, but if I miss something as we go, you guys feel free to type it in. NAD, they were asking specifically any dosing for sub-Q and like any titration up and down. I saw a comment that Strive mentioned they have their dosing sheets, so that might be helpful if you want to drop it in there, or where they can contact you, because we also had a question about wanting to reach someone at Strive, like a PharmD or something like that.
Yeah, so you can always email clinical@strivepharmacy.com for any questions. That goes to all of us clinical pharmacists. I didn't get the chance to get to the dosing of NAD, so I apologize for that. But for subcutaneous, as we were saying, start low, go slow. Our dosing, our vial is 200 milligrams per ml. So we most often don't dose it in units, just because a patient is able to use a tiny insulin needle. So often starting at about 10 units or 0.1 mLs 3 times a week for a week, increasing to 20 units 3 times a week for a week, all the way up to most oftentimes the max dose that's recommended is 50 milligrams 3 times. 50 units.
50 units.
Excuse me. Thank you. 50 units 3 times a week. thereafter. So that's kind of what we see as far as dosing goes. I don't know if Rhonda has any other input on how she likes to dose the subcutaneous, but spreading it out through the week does seem to provide a lot of benefit. So
Yeah, 2 to 3 times a week, starting in that 25 milligram, especially if you've never experienced NAD, 25 milligram range, subcutaneous, increasing, working your way up to as much as 100 milligrams, which for Strive's concentration is the 50 units, 3 times a week.
And
It's
Another thing to
higher
think
before a workout, I'll tell you. It's a great pre-workout.
That's another thing, Ron. I'm glad you said that. Make sure if you're not using our product, whatever product you're using, don't necessarily just take that guideline that we just said, because everyone makes them in different strengths. Same goes with the GLP-1s. Just because you took 20 units on somebody else's doesn't mean you should be taking 20 units on Strives. Like, make sure we're looking at the doses before you.
Yeah, and I would say that with anything, I mean, that we've talked about. Oh, and we had conversations on Somorelin, we've had conversations on NAD with methylene blue. You know, you really have to look out, you know, I'll tell you, I was doing, got something from a pharmacy. I dosed out what I thought was the same, but I had tripled my NAD dose. IM, and I will tell you, you can't slow down a drip rate when you do an IM, just to let you know. So I'm sitting in my kitchen, or actually I was standing, and all of a sudden, like I get just this rush comes over you. And here's the thing, just so that you know for your clients as well, or your patients, like that rush isn't always instantaneous. Like it can take, you know, 30 seconds to a minute. And all of a sudden it's like my breath is taken away. I feel this rush. My heart is pounding. I walk in, I'm like, I'm going to sit down for a moment. And in about 15 minutes, I was fine. So I think that's another great thing, whether you're doing in office or if you're sending home to do like the sub Q, or somebody's doing IM, you know, after they do it, just make sure that they're sitting there for a few minutes so that you can monitor, see how they're doing. Same with the IV. We would always have a 15-minute post, or we're just sitting there checking them, obviously checking the vitals and doing that. So make sure that you have your pre-post typical setup as well.
and I will say I did the same thing. I injected it actually into my stomach area, and I didn't have a lot of fat in that area, and I must have just got it right straight into brain, and I just immediately froze. Like, but it did subside. So I actually choose to inject it in my glutes now, just because I know that there's going to be, you know, enough fat in that area.
And we're not saying this to scare anybody away from doing NAD because it is amazing.
It's just a warning. It's a warning. It can happen. I mean, look, it
Yeah.
happened to both of us, and we're
It happened to me too.
Yeah. So Rhonda, with you, like, you know, crushing it in the clinic with your amazing close rate. I keep saying this, guys, because this lady is incredible. How do you explain to people with NAD? Like, what do you say to them when you're talking to them about utilizing it?
So I talked to them about mitochondrial enhancement, working our way back from what mitochondria is. We all can explain that to our client. And then I told them, I always relate my own first experience with getting my NAD IVs as my brain was lubricated. And then my patients are telling me they see brighter colors. We used it a lot during the C virus pandemic for post-viral fatigue, and how it just turns on the motors in your cells. And so we do like a brain refuel protocol of several IVs in a row, just to help that, so you feel it. I've had some questions in the chat about, is sub-Q good enough? Do you need to do a loading dose? I highly recommend you do IV NAD for a client until they feel the effect, and then they can maintain it on sub-Q, because sometimes it takes a long time for the sub-Q to get to that awakening of those brain cells. And so sometimes, I don't know if you've ever had people you give them one injection, like, I didn't feel anything. Well, it's probably true. They might not feel anything. That's why I really advocate for the IVs leading up to, and then maintaining on the sub-Q, because then they know what it feels like.
Well, yeah, you have to think, I mean, how deficient are we in most things? I mean, from cellular exhaustion across the board, mitochondrial exhaustion. I mean, small doses over time, yeah, can begin to refill. It's kind of like if you're trying to fuel your car tank with gas, but you're only putting in half a gallon at a time, and you're driving to the next place, half a gallon, driving to the next place, half a gallon. It's like, let's fill this thing up. We know it's going to come down, but before it gets to E again, let's fill this thing up, and then we can start to maintain so it's not dropping down all the time. So,
Yeah.
Yeah, I think that there's some questions on dosing and whatnot, and I will tell you our info sheet does provide some of the IV recommended dosing. So again, recommended dosing as a provider, please do your research, please understand. But the info sheet is available to you, especially if you want to email the clinical@strivepharmacy.com. We're happy to send those along to you. Absolutely. I will say NAD, I always say I feel like it provides me with clean energy. Like it's just clean. I feel good. I feel, my brain feels clear. So just good, clean energy versus drinking my Diet Coke, which I was just drinking. So sorry, guys.
We're
I know.
still going to drink the Diet Coke.
Yeah, we will. But that's us.
I was gonna pop in and actually just add to that as the business owner side. There's 354 attendees on here, and I don't know about you all, but if you're attending this webinar, that means you're a provider and or an owner. And I think right now we all are like convinced we need to be taking this for ourselves. So like, it's, we need our tanks fueled too. And I know my personal experience with NAD has been life-changing as the business owner and helping me have that mental cognition and, like the clearing of the brain fog. And like, you guys were talking about your, I can't remember whose husband it was. For me, I experienced that as well, like my checklist and remembering what I was supposed to do that day when I showed up to the office and things like that. So
awesome.
Yeah, and it is
Methylene blue questions.
This sounds silly, but it's even a product that's very much trending in the social aspect. So a lot of people have heard NAD. They've heard it. They know about it. So it's something that your patients might be coming to you asking for at this point. So it's great that you're here learning and gaining knowledge and gaining, finding where you can get access to a good, clean NAD product. So.
Absolutely.
I just want to kind of touch on this. I saw a question pop up about the strength that we offer. And I know that some other places offer like a higher strength, like ours is 200 milligrams per ml, but the pricing that we offer is competitive. So just when you look at that, it's a 10 ml vial. So you kind of have to look at, you can't just go based off of the strength we offer versus the strength someone else offers, if that makes sense. So when you look at our sheet and you look at our pricing, if you do the math, we're very competitive.
Yeah, and I was actually just pricing it out yesterday. We're considering start doing a 6 ml vial as well, which is going to be perfect for those patients that are at the 50 units 3 times a week. So it's the 28-day puncture, USP puncture guidelines and whatnot falls within that. And I was comparing our pricing to a number of other compounding pharmacies, and we're actually probably one of the least expensive. So, and we can also speak to the quality of our product. So our products are
But you're willing to increase your prices if you want, though, right? I mean, if they're looking for
expensive,
Yeah, if you want to pay more, we'll take it.
Yeah.
But
And as a provider,
we also have a lot of questions inquiring about the effectiveness of like what you're noticing from the nasal spray versus IV, and if you see a difference there, or if you can speak.
Well, I believe that was touched on. I mean, the IV is probably going to get, I mean, that's direct. You're going to get the most effective. So that nasal spray is going to be a little bit down. Sub-Q, anything that you're getting, sub-Q, IM, IV are always going to be the best. I mean, to me, nasal spray, there's great effect, but you're still trying to get through the mucosal cavities. There's all of that's happening too. So, yep.
Okay, so on the methylene blue questions, I know we're getting close to the end here, so I'm going to try to group them if I can. So we touched a little bit on the SSRIs. That's come up quite a few times, but also hepatic or renal considerations, kidney stones, and red light therapy and activation, and when or protocols are you utilizing that or finding value in that?
Yeah, I was actually reading methylene blue and red light therapy really has incredible synergistic effects. So, very, very great results in that. As far as hepatic and liver, always be careful with those patients with hepatic and liver, insufficiencies whatsoever. We did touch on the patients that have the G6PD deficiency. Definitely use in great caution with those patients. Methylene blue, it's metabolized by the liver. So patients with, liver deficiencies or whatnot, again, be very careful there as well. But you can do very, very low doses, and they will still have great benefits. So there is the positivity in that.
And regarding cancer and tumor growth concerns there, or with patients with a history of it or current diagnosis of it?
And Rhonda might be able to, and Adam might be able to hit on this a little bit better. It's not like the growth hormone products, and that it's going to increase the chance of it increasing tumor growth or whatnot. It does increase mitochondrial function. So by increasing those mitochondria, increasing that ATP production, I could see how there could be some concern. I don't know if Adam or Rhonda want to hit on how they treat patients that have cancer or a history of cancer.
Yeah,
Rhonda, you want to go?
For methylene blue.
Is that it can potentiate growth. That is with prolonged use at high doses. And so I don't know about your clientele, but I know mine, they're not very good at consistency. And even personally, I'm not. So
I'm the worst.
if you're using, I mean, if you were going to do, 1,000 milligram IV every week for 10 years, I would be worried. But I rarely know anybody that will even do 100 milligrams 3 times a week for a month. So that my concerns are low. It is a theoretical concern, absolutely. But in reality, I don't think it's going to play out because consistency matters.
I also have to, you also have to think, and if you go back even to the mechanism of action of a lot of these, from methylene blue to NAD, some of the things that they're doing is they're regulating insulin levels, they're regulating the glucose levels, which in effect, what those are also doing is actually increasing immune system function and decreasing inflammatory responses, which are positive things to help suppress cancer at the same time. But again, you just have to take caution. I think if it's something that you're going overboard with, if you're doing things in low doses, now this is a medical disclaimer, we're not giving you any advice on this, but just look at what you're doing. And I mean, if somebody's cancer free for, up to a year, 2 years, I wouldn't worry as much, but yeah, if we know that high dose vitamin C can have a very strong effect for cancer and cancer treatments, then I don't see why methylene blue wouldn't be able to have a very strong effect in helping with that as well. And if you're doing something low dose with NAD, there could be some efficacious results coming from that too.
We've been talking about methylene blue, but I do want to point out that NAD plus, we do have a warning for cancer patients on our info sheet. So same thing, like it can help proliferate cells. So you definitely want to take caution in that. And if you email us and we send out our info sheet, you will see the warning on there.
Yeah.
These are also things you can input into your consent forms in your practice, and we'll have some, examples and guidelines around that as well at the GLP-1 Summit, so we can dive deeper into, some of those perspectives.
Awesome. All right, we're at 2:02. And before I say anything, because we still have a lot of people on here, the moment I start to go and it gets like 2:02, then all of a sudden like drop off rate, everybody's gone. Last time we actually stayed 15 minutes later, and it was amazing because people had some incredible questions. But I do want to mention again, we will all be at the GLP-1 Summit coming up April 18th and 19th in Phoenix, Arizona. We are super excited to have Strive there and their team. We have a team. We're going to be speaking again in more deep dive onto supplementation and GLP-1s. We're going to be talking about things like LDN. We're going to be talking about the blueprints to help build a practice, not just on GLP-1s, but really building a practice about who you are. Lindsay gives us incredible keynote on, don't be, what is it, don't be the candy store. Say you
Clinic.
yes.
Candy clinic.
And how you want to build these practices from the heart and to be able to grow, but we do this to help you to again stay ahead of what's coming, being proactive, not reactive, not being afraid of where the industry is going, because what you have to offer is more than just a GLP-1. I think that needs to really come across, that what you have to offer as a provider, as a business owner is beyond that. And so what are the things that we can do for that as well? We're going to be at the Wigwam Resort again, April 18th and 19th. The code for that 35% reduction in cost is NAD35. And so Christy's going to be able to put the link in there again for you, NAD35. And this will be the last, as far as I know, discount that we will be offering up until the event. That code lasts until midnight tonight. So you have till this evening to be able to
When you
utilize
say
that.
midnight, is it midnight Eastern or
Oh,
Pacific?
that's a great question.
I actually set it to 3 a.m. like Eastern. So
Yes.
you're good in any time.
Covered. Okay.
I have made that
So
mistake
I'll
in
go
the
through
past.
this.
I've
It'll
got
be
a lot of emails.
3 a.m. Eastern, 2 a.m. Central, 1 a.m.
That's if you make it to midnight, you're good.
Yeah.
Okay.
Yes.
Uh-huh.
Most of you should not be up. You should be getting your rest. Okay. So
Yes.
sleep is very important. Even though we
Yes.
want this energy,
Marlon,
sleep is what helps.
great,
Yeah.
yes.
Yes.
I've had a
But
lot of
thank you
questions.
all.
I tried to answer
Yeah.
it too. Yes, if you're attending virtually, you still get all the slides, protocols, handouts, any templates, consent form, things like that. It's all recorded. So if you can't watch it that weekend,
And-
you may watch it after.
Right. And one of the things that we do different with our virtual is we actually will bring our presenters literally live in front of that camera so you can actually ask one-on-one questions to them for our virtual attendees. You don't just have to be in person to be able to get that type of one-on-one connection. So I think that's a really big thing that is appreciated for how we run our virtual.
I saw Naomi just bought a virtual ticket, so congrats to her.
Yay.
I'll be there with this.
Oh, the blue. You got the blue.
Yeah, it's
If I
fun.
didn't
It's a
wear
lot of fun.
blue, I figured I got to put it some on. Like,
Yeah.
I just,
And we'll probably have to turn off the in-person attendee ticket sales pretty quickly. So if you're on the fence about that, make sure you grab that now because I don't have very many slots left. We intentionally capped it to keep it, really foster a lot of conversation and community and connection with all the speakers. And we will,
Yeah.
it's because it's a combination. It's a both deep dive into all the protocols and the medical side of this industry, but also the business and how to scale and grow and what strategies from marketing and what's working there. And that's really where Lindsay and Rhonda come in with their magic. So we want to make sure everybody that's there has time to really dive into their own strategies that work for them as well.
Absolutely. There's a question on CME credits. There are no CME credits that we offer through our trainings. We do offer certificate of completion, which actually does set you above standard across the board. There are not many places that are doing true GLP-1 trainings. We're going to be going even beyond, like I said, GLP-1s. We're excited to have Patrick Porter there. We're going to do the coaching, the consulting, how you run through these, how do you build the practice. Yeah, it's going to be a lot of fun. So we're super excited and honored that every single one of you stayed. Is there a code for hotel booking? Somebody just asked.
I'm answering that now.
Okay.
I'm typing it as we go, but the hotel, they always expire that booking link about this far out. So expired yesterday or today. But if you send me an email, training@medbioinstitute.com, we'll just negotiate with the hotels. The Wigwam has been phenomenal. They're a privately owned resort. So we'll make sure we get you a deal or get you into the room block or get you a room. The hotel is almost sold out. So just shoot us an email if you need room info, because if you see a discount or a room block link, like in the FAQs at the bottom of the page, it won't work anymore as of today. So,
And with the virtual tickets, you won't need a replay because you'll get a recording. So that's awesome.
Yeah.
And from here, I would say goodbye, but how about we answer just 2 more questions, and then we'll close out the webinar. Christy, do you have any questions
let
that
me
you
go
could?
open and see what we have. Joey did a
Okay.
great job of answering. Thank you, Joey.
Thank you, Joey.
Yes,
Hey.
he was doing fantastic in there. I saw him answering like microdosing on the the methylene blue microdosing thing. He is that, and then also tirzepatide. We had a couple questions on your testing protocols, and I know you guys were going to speak at the event quite a bit on the Strive standard and help them understand what to look for in a compounding pharmacy and when they're making these choices. Do you want to speak a bit about that for everyone? Because that's something we haven't had a chance to address.
Yeah, that's one of the things that Strive Pharmacy really is so proud of, is our testing, is our compliance. We have a ginormous compliance team, a huge quality assurance team. Our goal is to make sure the product that your patients are receiving is the highest quality possible. So we know exactly where APIs are coming from. We have the certificate analysis on all of that. We're happy to share any of that with you. Our APIs come from a domestic API, CGMP certified, FDA registered facility. Everything is tested initially. All of the compounds are tested initially, and for potency, for sterility, for safety, etc. And then they continue in testing. Our goal is always to have the longest beyond use date possible for your patients. But the one thing we for sure do, especially with our GLP-1s, is each batch that comes out is tested again for sterility, is tested for the safety, lack of endotoxins, and then we do random potency testing as well. So we test the different strengths, we test different vials across our different locations each week. So we make sure that your patients are receiving a standard dosing across the board. This allows us to make sure that our patients are getting standard products and that our compounders are also compounding to our, to our standards, I should say. One exciting thing is we're actually releasing liraglutide today. So that's going to be an additional product that will be available, an additional GLP-1 that will be available to your patients. With the kind of the unknown landscape of tirzepatide, while Strive has kind of made its statements on it and whatnot, adding the option of liraglutide is going to be great for your practice. Just in case you have patients that are maybe wanting to switch over to something else, or you're choosing to as well. So, yep.
Thank you so much.
Is it my turn again?
It's your turn, Adam. Final
Yeah.
say goes to Adam.
Final say. Final say is always this. Thank you all for taking time today to come in, hear this incredible information. So thank you, ladies, both for sharing your insights and just bringing the knowledge to these providers, to these practitioners and business owners. Thank you, Rhonda and Lindsay, both for being here as well. And we're excited to see everybody that is going to be attending this GLP-1 Summit live and in person, which is where it just gets so much fun. So again, thank you all. I know that you all have had a time spent here with us. Now go make sure that you go crush the rest of your day and go help some people, change some lives. Thank you so much. See you later.
Bye, guys. Thank you.